Louisiana. He is also a doctor. And Congressman Fleming, Boehner is correct to a certain extent in that, yes, if an illegal immigrant with their own money that they make, either cleaning somebody's house or working the farms, whatever they do, if they use their money to buy insurance, they can get insurance. Are you suggesting, are the Republicans suggesting that their money is no good, that they should not be entitled to buy health insurance?
Well, we're not suggesting anything like that. The only thing we're saying is that if someone is an illegal immigrant, that this bill does not require any verification one way or another. And there are many aspects of this bill where someone may receive health care for free. For instance, under S-CHIP today in Medicaid, there's no real verification process. So let's be clear, S-CHIP, we're referring to children. So in other words, we could be talking about a 5-year-old who by no fault of their own, their parents are illegal immigrants, they get cut, they go to the hospital. What do you propose that hospitals do when they're confronted with the children like that? S-CHIP actually covers adults in many cases as well, and the point is there's no verification process. Not to suggest that we should refuse care to illegal immigrants, but in terms of coverage, taxpayers need to know who's getting the coverage when they're paying the taxes. Well, let me read to you what's actually in the bill, as opposed to what was not put in the bill. What's in the bill, and here's the exact wording on illegal immigrants, and this was approved by 3 House committees. Nothing in this subtitle shall allow federal payments for affordability credits on behalf of individuals who are not lawfully present in the United States. It seems pretty clear to a lot of people. What's your issue with that? Well, because if you do not have a clause in there that requires verification, then there will be a de facto mandate, if you will, that they will be covered. That language is actually useless, and if you look at the Congressional Research Service, which is academic and nonpartisan, they came out today saying and agreeing with the Republicans that illegal immigrants will be covered under this plan. Well, they will be covered, again, let's be clear, they'll be covered if they pay for it. Well, there are people under this plan who will not be paying for their own coverage. Taxpayers in many cases will be paying for their coverage. And so that being the case, unfortunately, illegal immigrants will receive taxpayer funding of their health care coverage. If somebody's getting something for free, then there's something in the bill that a lot of people don't know about. But Tamron, go ahead.
Yeah, Congressman, I want to ask you, many people are wondering if it was possible to change minds on the right. The president tried to include, for example, the idea of malpractice reform, and the GOP response from a member of Congress from your own state was maybe this is just lip service. Is it possible at this point to bring in both sides, or are heels simply dug in, and as the president pointed out, some just wanting to kill health care reform? Where do you stand? Was there anything you heard yesterday, sir, that might bring you into the fold, or at least of the conversation? Well, unfortunately, the president mentions something about health care, or rather malpractice reform, but the bill he's referring to has no language of that, and it's passed through all 3 of the committees. And the only thing he mentions is some kind of project out in the future, some sort of pilot study. We have 50 states who've been providing that coverage for many years. We have the evidence we need. We know what kind of reforms we need. The Republican-controlled House passed malpractice reform several times, but it never made it through the Senate. So we know what we need to do. Unfortunately, the president is not really supporting that. Well, just so we give you an opportunity to see if there's anything that the president said that you agree with. Do you agree that insurance companies should not be rejecting people based on pre-existing conditions? Well, the goals we all agree on. That is, no denial of coverage because of pre-existing illness, no loss of coverage because of any current illness, portability, buying insurance across state lines. We agree with all of that. Where we really differ with the president is we believe that government-run health care will explode the budget, will lead to rationing and long lines. Congressman, it's not all government-run. It's government-managed, and there's going to be no government funds that are going to be used to sustain the public option. But again, that's a debate for another day. Congressman John Fleming, Republican, thanks so much for coming in. We appreciate it. And Tamron, yeah. They have a great way of putting in their talking points there at the end. Yeah, and both sides do it, but it's interesting with the government run. I believe it was Senator Boxer who was on last night in our coverage, who said that, you know, if people are prepared to vote against